During the pandemic, everyone's lives were just completely turned upside down, forcing many employees to start working from home rather than from the office. With this change in work habits, medical professionals across the country began to see an uptick in neck, back, and nerve pain. I had the opportunity to sit down with Doctor Kevin Gallagher, a chiropractor located in Palm Harbor, Florida, as he explained the difficulty of running his office, both as a small business owner, but also as a medical professional, where he needed to be able to treat his patients, but do it in a safe way during the ever-changing pandemic. In today's video, he shares one of the most common injuries that his patients experienced while working remotely from home, and how you can help reduce the chances of injury yourself. I'm here with Dr. Gallagher and just talking to you about how the business has been going. So you've been a chiropractor here in Palm Harbor, Florida for a little over 26 years now?
That's correct.
So can you kind of tell me some of the lessons you've learned from running the business that long and how that has kind of helped you keep things going?
I've been doing this for 26 years, and I think one of the things that's helped me, stay in business this long is we treat everybody like their family. So we treat them well, we find out what they're after, find a program that will help them to alleviate it, and if we can't help you with it, we try and find you the kind of doctor who can help you.
And maybe you can, obviously I've known you for years, I've previously been a patient of yours, maybe you can kind of explain for people, what does a chiropractor offer? What type of things can you do to help patients?
One of the main things that we treat all day long is neck pain, back pain, headaches, numbness and tingling down the arms, and numbness and tingling or pain down the legs. That's the bread and butter of what we do.
Is that predominantly from like car accidents or all kinds of things in life?
But definitely car accidents for sure, different traumas, people falling off their bikes. A lot of things that we've picked up from the pandemic has been the office environment changed from an office back to their house. So a lot of people were on laptops for extended periods of time.
And putting the positions, and so was it like more carpal tunnel?
Well, carpal tunnel and neck pain and headaches, from that, because you just can't.
Because you're hunched down more.
It doesn't work, because if you get this part right, where your hands are, then you're looking down like this, right? And if you get this part right, where your head is like this, you're doing something funky with your arms like this.
That makes sense. And I guess probably people being at home, maybe if they didn't have a desk set up, so they're kind of sitting at their couch or their kitchen table and it's not very ergonomic.
Exactly. A lot of kitchen tables and a lot of counters. So they're on bar stools.
Oh yeah, I guess that would make sense. And the elevation, depending on what height you're gonna be.
Yeah, and that just created all kinds of neck pain, shoulder pain, mid-back pain, headaches.
So that was stuff that you had not seen in great amounts prior.
Lots more.
So it happened a lot more prevalent.
Yeah. Lots more, yeah. So we had to teach them more ergonomics, we had to teach them how to set that up better at their house. And then once we did that, and then we'd start the normal adjusting process, it all cleared up.
So you would kind of help them not only fix and relieve their current pain, but also find the root cause of it, so you could remedy that and say, okay, by doing these adjustments of how your desk is set up, and is that the type of thing that would help?
Exactly, right? Because if you have to find what is the patient doing that's creating the problem.
Whereas a car accident, that's easy to, okay, it was a single car accident,
Right. So what is it? What are they doing? Are they sitting too long? They not sitting enough? They're walking too much? Or
and some of the things, like actually my audience knows that I had some issues with some of my nerves, and I came to you for that, and some of the issues that we've been trying to kind of work through that process.
Yeah, exactly. So you were the person who came in, we evaluated you, couldn't help you with the issue, sent you off to another.
Right, exactly. So you sent me off to a neurologist, and we kind of went down that path, and we're still trying to figure out the exact cause of things.
Exactly.
But what was great about it from a patient's perspective is I was able to come to you as a trusted provider. Said, of course, I've known you for many years, but I could come to you and say, Dr. Gallagher, I don't know where to go.
Yeah, exactly.
You said that you had COVID at one time, and how did that kind of impact your business?
No, I did. So when it first happened, we really hit around March of 2020? Yeah, so that's when we were trying to lock down for like the 2 weeks, thing.
So did you have to close the office?
I did, yeah, I did. We closed during that time or around that time.
Right.
That impacts the business because there's nothing, right?
Yes. Well, you're bringing in, you're still a business. You still had to pay your bills,
right? So with no income coming. Yeah, exactly. So that that definitely hurt. Then we opened up on after that 2 weeks, we opened up more on a limited basis. Then we eventually got into full time. But that was kind of interesting, figuring out what you were supposed to do.
Because it was kind of a mystery. Everybody, you had, politicians that were trying to help out, but nobody really knew the answers in a lot of cases.
Exactly, and that was kind of an eye opener. It's like you would kind of think, well, they've got a plan for a pandemic,
and they didn't.
If they had one, the messaging wasn't clear.
Exactly.
Put it that way, right?
And then as a doctor's office, there was probably you probably were able to open before some other small businesses could. Like, I know restaurants were closed a little bit longer, and I'm presuming doctor's offices could open sooner. Is that how it worked?
Yeah, we were super lucky because we were deemed the essential,
necessary.
Provided that, so we were able to stay open. But then we had to, figure out how are we going to see patients and still stay within the CDC guidelines.
Right, because obviously, doing chiropractic, you're up close and personal. You're adjusting someone, so you're definitely within that 6 feet.
Definitely, yeah.
How did that work?
It came down to a time thing. So we had everybody. We did all the screening procedures up front in the beginning, temperature, all that kind of stuff. It was a time factor. So everyone's masked. You needed to get everything done within 15 minutes. That was kind of the time where it's kind of like if you're in the room for that long, then you're going to. So we did that, and luckily the adjustment part of what we do.
It's pretty quick.
It's quick. It's a few minutes. See the patient and then scrub down the room. Everybody's obviously washing their hands way more than we did prior, but we made sure everything was clean. Had to follow those guidelines, and that was kind of interesting. Like I think I actually called the CDC and to get an interpretation of what the guideline was.
Okay.
But that's kind of funny because they don't really give you an answer.
It's kind of like calling the IRS for tax advice. They can't give you an answer. It's like, it's your department. How do you not know the answer?
Exactly. They were like, well, what do you think it means? And I'm like, well, I think it means this. And they're like, okay. Here's the, they sent you all this stuff. They had it all written out, and they would send it to you.
So there was really not much resource. If you called up as a doctor saying, I believe this is what I want to do, for my patients, and you were kind of in the dark.
Pretty much. Yeah, you just kind of had to talk it out.
Probably other doctors and
put your heads together. Exactly. What do you think that means? So we came up with the program. It was good, and we had some patients that ended up getting it. They didn't come back until the 2 or 3 weeks over, then they would come back. None of my staff got it until January of this year. Right? And I don't know.
That was right around the time I was about to come to you and make an appointment, and then the office was closed for a couple weeks.
Yeah, we had to shut down because I got it, the staff got it. Because somebody came in here that had it and gave it to us. Yeah, we think just with the timing of when we started to get sick and whatever, it had to be on this.
Well, I guess if you all got sick at the same time, you all had to been exposed at the same time.
Yeah, exactly. So it's like it had to be that. But that was also the time when they changed the guideline to you only needed to wait 5 days. Okay. And that's the time really when you're almost the most contagious.
Right.
So when we got it, I told the staff, listen, we're not coming back until you test negative on a rapid. So once you test negative on a rapid, you're kind of like deemed like you don't have enough of it to pass it. Yeah, so it's definitely less than when you're positive on the rapid. You're really contagious, basically, right? So we waited the full 10 days, made sure we were all clear, then we opened back up again. Right. That was 2 weeks though.
Because that was right at the time that I was looking to get my first appointment, and you were just reopening.
Just reopening.
I think I was one of the first appointments.
Yeah, it could have been, yeah.
I really appreciate Dr. Gallagher for taking the time out of his day to share his story about COVID and the importance of properly setting up your remote workstation to keep you safe from nerve damage and pain. Now, of course, remember that nothing in this video is medical advice, and if you have any pain, you should definitely consult a doctor. If you are in the Tampa Bay area, Dr. Gallagher can be contacted at the Palm Harbor Chiropractic and Wellness Center, located at 550 US Alternate 19, or by calling 727-789-0800. Links and all of his contact information will be in the show notes below. Thanks for watching, and I'll see you in the next one.